Okay, there we go. There we go. All right, this is very exciting. Sorry for all the delays, but we're getting started here. Everyone's smiling faces. This is good. This is great energy. Welcome to Workshop 1, Healing Within, Finding a Culturally Competent Healer. My name is Andrea Mackey, and I'm a Peter Harbidge Policy Fellow at CPEN, and I'll be your facilitator for this workshop. So Kieran earlier today had kind of touched upon, our communities. Our partners have found that from access to quality to structural and systemic issues, the lack of culturally and linguistically appropriate care is a major barrier for our communities of color and limited English-speaking communities. So when we're advocating for investing in care teams that includes peers, community health workers, traditional healers, and patient advocates, we're talking about investing in our communities who speak our language, who understand our background and experiences, and who holistically reconnect us back to the relationships with our bodies, our communities, and nature. And so I'm super excited to be sharing space with some of these community leaders, healers, practitioners here on the panel today. And so what I'm going to do, because we're a little bit limited on time, is I'll just start with Rita. If you can tell us your name, your organization, your pronouns, and about your work of increasing accessibility to find a culturally competent healer, and then we'll just go around in a circle.
All right. Awesome. Well, thank you so much, Andrea, for having me, and CPEN and CRAC, and for organizing this really important space today. So my name is Rita Pitme Sai. I go by the pronouns she, they, and boo. I am the creator and host of the Healing Out Loud podcast, which I created a few years ago, really to explore Lao diaspora storytelling, healing, and tools for sustainability. And so I know, there's a lot of different parts of what I'm trying to facilitate, but I created this space as a way to really create accessibility for my own community, the Lao people from Laos, who were basically torn from their countries and, ended up all over the globe. And so what I realized, growing up was that, after becoming, a healing practitioner myself, is that I didn't see a lot of me in higher education spaces, in healing spaces. And when I came to LA, so I'm originally from North Carolina, and there is a very, very sparse Asian population in North Carolina. We do exist, but until I came to LA, I met incredible healers, incredible just people, thought leaders, change makers, advocates, and I felt at home. And when I noticed in the beginning, in connecting to my community members, people from Lao diaspora, I noticed a common narrative about us still suffering from intergenerational trauma, from the war that our parents had to survive through up until my generation, the millennials, and then generation after me, Gen Z. I noticed that there's that common theme of, we are, victims of war, and, and kind of just putting us in that box. And upon my own healing journey of getting access to coaching, getting access to trauma-informed yoga, or, even going to my own fair share of therapy. I did a lot of different types of modalities myself. And I realized that, I can heal, and I can move and push forward the narrative so that we don't always have to be on survival mode. We don't have to create systems of oppression within ourselves that's already created around us. We can recreate generative narratives that are healing, that are welcoming, that feel affirming. And so for me, having that insight, that knowledge, it was like, how do I help my other communities? How do I pick them up too? I don't want to be the only person that has access to this space. So, which is why I created Healing Out Loud, so people can access important conversations about other people that are going through things and trauma, violence, but also are taking their power back as well, which is why I interviewed a lot of different people from my community to share their stories and to also nuance that narrative. It doesn't have to be so black and white of like trauma, war, disparity. It can also be about love, about community, about creativity. And so, 3 years later, it has transformed into a coaching, consulting space, workshopping, training space. But I'm very proud of, how it's unraveled. And really, it's a space to nurture um, uh, who I wanted to be for my younger self. And so I'll leave it here. And yeah, it's been an incredible journey. So I'm very privileged to be able to facilitate this work and create, push the public discourse on what does it mean to really heal and to find someone that looks like you in the community that has done it.
Oh, that's inspiring. This is great. And then we'll move on to Dr. I see you ready to put your mic off. Dr.
Off, yes.
Yes. So if you would like to share who you are, your pronouns, about your work as well.
Yes, no, thank you so much for the intro. Thank you, Andrea and CPEN, for having me. I'm very grateful to be here. My name is Jamila Young. My pronouns are she, they, her. I might incorporate boo. I like that. I am the creator of Young Psychotherapy and Wellness, Jamila Young, PhD, LLC. I am a practice of one clinician. It's just me. And so when I think about it, this was actually a very interesting question because it forced me to really think about ways that I do incorporate holistic healing and ways that I think about accessibility. In regards to, and from a cultural lens. And so when I think about how I increase accessibility in finding a culturally competent healer, I think one of the biggest things that I do is I strive to be one. And doing so allows me to often end up in spaces with other culturally competent or clinicians who are striving or healers who are striving to be culturally competent. And that's it's been a great teacher for me. And it's been something that has allowed me to pour a lot into my work and has allowed me to build a referral list of culturally competent clinicians or clinicians who are striving to be. It's challenging for me to just say like one is culturally competent because that's a growing, evolving thing, which is why I keep like stopping and adding striving. But I may forget to add the striving, but you guys understand the context that I'm communicating in. And so, they become my referral list. And also one of the things that I have done, as Andrea mentioned or alluded to, if she didn't directly mention, and Rita definitely mentioned, that there is a lack of people of color who are in these spaces, in higher education spaces, as healers, when you think about like from a clinician perspective. And so I didn't have a lot of guidance. I was the only Black woman moving through all of my trainings and academic endeavors. And so now that I'm on the other end of this, I do a lot of workshops around healing and mindfulness at the corporate level, really connecting with ERG groups that are around people of color. And want to express to them and show them that although it is more challenging because the numbers just don't lie. I mean, we are just lower in numbers doing this work, that we do exist. And that someone does understand from a different perspective what your experience is, because the amount of racial trauma and unconscious bias that I work with people of color in the corporate space is astounding. And so that's really, accessing those individuals has really been rewarding for me in that regard.
Wow. Thank you for sharing. And then I see Rochelle. I'd like to also answer the same question.
Thank you for having me here. And I'm so honored to be on this panel with amazing individuals. My name is Rachel Chambers, and my pronouns are she and her. I'm a Black woman from Oakland, California, grew up as a leader of family my grandmother was a healer from the South, Louisiana. My mom, healer. So healing has been in my life. Service has been what I know. And then being from Oakland, it's like you're trained, like the revolution will not be televised. And so and cultural and diversity. So I really am thankful to be here. And so I started a nonprofit called Painted Brain, and we provide peer support services and clinical mental health services, including occupational therapy. We also provide digital literacy and advocacy education around ensuring that there's culturally relevant and appropriate services in the healing space and in the wellness space. As a Black woman that co-founded a company in a space that is surrounded around and founded off Western tradition and practices, it's been really important to me to understand cultures. My background in sociology and me writing for over 10 years for diverse communities, including the API community, Latinx community, African American, for LGBTQ, allowed me the opportunity to have a really understanding and more passion and actual practice on how to support other communities of culture. So starting my own company that has evolved from no people to 40 employees, I'm very proud to say that we have a diverse group of healers and peer support individuals and clinicians that go out and use their cultural experiences to really support individuals. We partner with the African American, a lot with African American Latinx community. The Black Mental Health Task Force allows us to be able to incorporate African and practices in our work. So healing circles, sound baths, spoken word is one of the things we incorporate. We also have Mandarin groups and healing spaces and yoga that individuals of other cultures facilitate. So it's just really my goal to create a staff and create advocacy opportunities to put people of color in spaces where they can incorporate their community defined practices and really be able to heal people. I just believe that we just one size doesn't fit all, and so we really, if the tenets of this field is to meet people where we're at, then we meet people where they at by speaking their language, by understanding their culture, and then we find a bridge. So I'm really, like I said, I keep saying I'm honored, but to be in the space where people acknowledge and validate that other cultures and practices are valid and they are in the space of mental health recovery and wellness. Thank you.
Thank you. And then I know, Carlos, you've been having some tech issues, but I don't know if you're able to share, a short introduction of yourself and your organization and your work to increase accessibility and finding a culturally competent healer.
Okay. Yes. Hello. Can you hear me?
Yes. Great.
Hello? Okay. All right. Let me try something here. Yeah, I don't know. I'm having some technical difficulties, but happy to be here. Thank you for inviting me on this wonderful panel. My name is Jose Carlos Rivera, and I am the CEO and founder of Generation Red Road, which is a national nonprofit located in Sioux Falls, South Dakota. And I'm also the behavioral health officer at American Indian Health and Services, which is located in Santa Barbara, California. And so I primarily work in Native American communities, providing training and technical assistance to tribes all over what we call Turtle Island. So there's over 570 something tribes in the United States, and probably another few hundred in Canada as First Nations. And so our organization probably has worked with at least one of them at one point in time. And then also originally from Northern California, born and raised. So I'm a Cali boy. Always find my way back home. And I'm happy to be here to get things started. Thank you.
Great. I'm so glad you were able to hear you. You're able to share, and we're here sharing space. And so, I guess in the going back to the theme of this workshop, how do you find a right healer? And anyone can take the stage, jump in at any point.
I mean, I guess I can come from an employer perspective, and look at just making sure, of course, making sure people have the background and experience, because I'm in the mental health and peer support services, but then really talking to individuals about their cultural experiences and their practices. For me, it's important to just vibe and to see what works, because like I said, not everything fits one, person. So for me, looking for people who are healers in our field is really giving them the opportunity to express their cultures, their background and practice, and how we can incorporate that, and being able to vibe with someone that can help you bridge the two, right? Because for me, in the mental health space, we still have to operate, on a certain framework, and, the DSM and, the rules. So it's like that person having to know, I mean, and this is my healing space, like having to know, the framework and the background, and then like, hey, let's incorporate everything about your culture and your healing practices, and how we can meet these people, what in language, if they're, we do some work we in Santa Barbara, and there's I think the Mixteco, there was a monolingual community, and it was like, well, how do we meet those folks? And so we did art and drawing, and just from an artist in their community to be able to express, like to learn more about mental health and where to get help. You know what I'm saying? So really being able to work with just various communities and find creative strategies for us is like how we find the right healers, and people that are unapologetic about their practice. And and I'm so proud, like I said, like the other folks on here, like you definitely got to be unapologetic, to be in this space. And that's what we're looking for at Painted Brain, people that's willing to, that understand, the context or framework of our practice, right? But then like who are unafraid to be able to advocate and for their culture and their practices, to be able to empower communities. Because it's mostly, for me, I focus on disenfranchised community, ethnic enclaves, folks that don't really have a voice. So it's like you got to be ready for the work. So that's what we look for, people that's ready to get on the ground and understand folks.
All right. I'm ready, Rachel.
That's right. I'm ready. You already know. You don't know.
All right, hire me now. It's amazing. So, I think for me, I want to start off by saying that in terms of therapy, because I'll use it interchangeably with healing, or healer and healing practitioner. So just because someone is a good therapist doesn't mean that they're the right therapist for you. It's a metaphor I was thinking about, reflecting on the other day, was like, maybe you need some teeth work and you're trying to find a dentist, but an eye doctor, you found a really good eye doctor, but you got a cavity that you need to work on. So, it's really about being able to understand what your needs are when you're looking for a therapist, a healer, a body-based practitioner, and trying to figure out, like, what are your values? What parts of you are the most important to you? As healing practitioners, we have things that are important to us. Like, to me, what stands out for me as a healing practitioner was my Lao identity. That was so erased, which is why I was like, nah, I'm going to center it, because then you can't erase it. My platform is going to be Lao AF, and so, I created everything under, okay, so it's like Lao American, you can be Lao and queer, you can be Lao and low economic status, Lao and I'm like sporty. But, something I realized that was so important, and it's because like I was raised with a strong Lao dad figure that made sure that we knew that we were Lao. And so for me, that's important for me. But if I work with somebody and they're like, well, I'm Lao, but my queer identity is most important to me, then I'm going to refer them out to somebody who is like going to be specialized in, okay, like, in queer spaces, and they're connected to resources, and they really are going to have that be the highlight of their sessions. So I think it's important, again, to kind of think of finding a good healer for you, the right fit for you, being able to have some time to reflect on what is my personal value system, what do I care about the most, and it's kind of like dating. You're dating to find like somebody that is good for you, right? And you should shop for a lot of different therapists, because again, I think there is because of social media, because of technology, there's more and more people that are getting more into their work, and it's important to also have questions available for your therapist or your healer, to see if your values aligned and to actually see if they are competent for you. I don't like to use competent or culturally competent, because for me, it seems like there's like an end goal, like, okay, I got trained and all of a sudden like I am like the expert of this culture. I like to use like culturally relevant or cultural humility. If someone's able to learn and to gravitate to what your needs are, and have a growth mindset, and is able to, like validate your experiences, but also challenge you, so that you're not stuck in one area of your life or one mindset, that we're looking at the multifaceted experiences that we all have as human beings. So for me, I'm speaking from my own personal experience of going through a lot of different therapists, going through a lot of different, institutions, and figuring out, okay, so like, this is how we navigate it. But again, at the end of the day, it is up to you. It is up to your need, and no one can call that for you. So that's where I would start.
So I completely agree with both Rita and Rachel that we know that the biggest factor to determine if at least therapy, and I think this can be generalized to healing, is going to be effective, is going to be your connection to your healer. And so that fit is paramount. And so I think that, as Rita stated, checking in with yourself and what it is that you're looking to get out of your healing experience, while you're also doing a lot of research, right? So that you can do the research to find the person that Rachel hired, right? Who was vetted, right? So you're checking in with yourself and doing research to find out who's available to meet the needs that I'm identifying as you're checking in and reflecting, right? And then I tell people all the time, you can have multiple healers, right? Like, you can have a therapist, you can have an energy healer, you can have a health coach, and you can build, right? So you could come and see me for therapy, and then we could hit a bit of a ceiling, but that doesn't mean that you're done with your work. And then maybe I'm referring you to another therapist, right? I'm always telling people, your job is never to take care of me emotionally. You hire and you fire your healers. Right. So if this is not a good fit, if you're not being benefited, or you feel like, you're needing something that I'm not trained in, that I can't offer you, then you don't take care of me emotionally. I'll get my healing elsewhere. You get what you need. And that's just so important. I don't think that can be done without research, without checking in with yourself, without being open and flexible to dating around, meeting with someone and meeting with someone else. I think that's so important. And then be mindful of the modality also when you're doing your research, right? Like, are you open or curious about certain things? Because we hear a lot anecdotally also, right? Like, oh, well, this friend saw a shaman, or this friend did ayahuasca, and this friend, and not everything is a good fit for every person. So think about these modalities, and are you comfortable with the body work? Are you comfortable doing the kind of work with the clinician or the healer that you've identified is a good fit for you? And I think credentials. I think any kind of healer should have some kind of training. And I'm not talking about like rating healing on a hierarchy. I'm just talking about training to be able to say that you can guide someone to a space of healing. Because thankfully, health and wellness is very in vogue in a lot of ways. But what that means is that you have a lot of people popping up who are like influencers or who may have done a lot of work on themselves for healing, but an experience does not make an expert. And so I think we have to really be mindful of the sources that we are researching and accessing to be a part of our healing journey and process.
Oh,
Okay, I'm
that's
done.
powerful. This is great. I mean, I'm hearing a lot of, it's fall and it's a time of reflection and reflecting. So this is perfect. I know we technically have 5 minutes. Please, if you have any questions, put it in the chat. We'll keep answering. But I just wanted to ask you all, what are other holistic forms of healing outside of talk therapy? I know you've all kind of touched upon it in your answers that you're utilizing in your practices.
I feel like I'll go first because I think mine is probably going to be like the shortest, the most succinct. Because I personally, I'm a PhD clinician trained, like licensed clinical psychologist. So not much in any of my training was about other holistic forms of healing. And so I've really grown into being a lot more interested and curious in it, and have built on some of the things that I did experience in training. So I got a lot of eating disorder training. And so I did my own work in addition to the collaboration that I got with nutritionists and things like that. And so I can incorporate some health coaching. I got really interested in mindfulness because I see a lot of patients just with like selection of the kind of patient I work with a lot of mood stuff, anxiety. And so while, addressing challenging thoughts and maladaptive thoughts is all very helpful, I think that there's a lot of value in mindfulness and grounding. And so I've done trainings and done a lot of that work. So I incorporate a good amount of mindfulness, like journaling, breath work, guided imagery work, that kind of stuff. I've done workshops where I've hired yogis because I also know my limits. Right. So while I can do some health coaching, I know a limit. And it's like, okay, now we need to refer you to a nutritionist. And, the same thing, like I'm not a yogi. So if I'm doing a workshop and I'm incorporating yoga, I'm bringing in my girl, Wendy, a Black yogi who trained in India. She's coming in and we're going to add that part. We do meditation and things like that. So yeah, that's probably the extent. I honestly relocating from DC also kind of like the Northeast and think about psychology and analyzation up there, and then coming to someplace like LA, California, I get a lot more exposure to energy work and Reiki and things like that. And so a lot of my patients have exposed me to some of this work, and I become very interested. And so a lot of my incorporation has been very much like self incorporated or seeking out additional training in that regard.
Would anyone else like to respond? There's also a question in the chat, but feel free to jump onto this current question about the healing practice. Rachel, I see you were about to talk, so if you wanted to add on to.
Oh, yeah. I mean, mostly I'm an employer, and so I'm a systems individual with a culturally a competent or humility lens, always looking to incorporate other cultures and practices. So like Jamila, I usually partner and hire individuals from various backgrounds and cultures, and that can incorporate meditation, yoga, sound baths, healing circles, like with the Black Mental Health Task Force. We do a lot of that, spoken word, poetry. So yeah, I think it's more so for me developing a profile of clinicians, peers, individuals with lived experience to utilize their practices. And of course, like Jamila was saying, making sure folks have training. And that's really what we focus on as well with the new law, SB 803, which will certify peers, people with lived experience, like we have some competencies so that there's a framework and an expectation to where we can really utilize what the rules are, the law, and then incorporate our own practices in different cultures. So I'm really excited to get that law passed and to really incorporate different healers, because there's a whole new law that'll just make it easier to, they'll integrate with multidisciplinary teams with psychologists and social workers and OTs. So I like to integrate and with practice. So yeah, I'm excited about more of the work that I can do. And yeah, that's how we incorporate it. And I have a lot of flexibility too, now that I understand the framework of clinical, therapy and practice. So once you understand the framework, it's really a lot easier to just do the work. That's why I think we should have more. I know it's time to go, but we should have more spaces like this, because it can happen. We see it happen. It's just need more advocacy and more psychologists like Jamila, and more practitioners like all the rest of us to come together and advocate, because we know the rules. Okay, let's bring everybody in. All right, I know there's 1 minute left. Go, Rita or Andrea.
Well, I just wanted to say, as a last thing, one last sentence. It's really the issue and just the critique of the mental health professional field is that it leaves out the connection with the mind, body, and spirit. And there's like a disconnect. It's like, oh, mental health and talk therapy only, but that's systemic. And so I think as practitioners that come from, ethnic background, people of color, practitioners, we kind of have to resort to our own cultural wisdom in order to really challenge the system and reach out to community connections, like accessing community spaces, like going to the temple, for example, and accessing just like the assets outside of just that one-on-one space. And so as you're thinking about finding your culturally competent healer, it's good to kind of just maybe ask those questions of like, what else do you do outside of talk therapy? What are things that I can learn from you that I can grow just besides this one-on-one space? And they'll be able to hopefully tell you candidly what their experiences are and what they're doing to challenge the system that is quite frankly already setting us up for just one way of thinking. So
yes, we love to hear it. That wholeness, that is what healing is, that spirituality. You're really affecting all parts of yourselves. And so if there's any other final thoughts, I want to share them. I know we have hit time, and I wish we had a longer time, but if there's that question in the chat, if hopefully you'll be able to connect with folks here. I don't know if you've seen how much love you've been creating in this space. Everyone has been like snapping, clapping. I mean, probably virtually. I feel that energy here. So if any of the audience members want to give a shout out, give a thank you, share some love. I wish we had more emojis to populate here in this space, but this was powerful. So I want to make sure we still stay on track. And I wish we had more time, but our next panel, we will be moving to the orange stage to announce our zine winners and listening sessions from a multicultural lens. And so to navigate to the new stage, just go to the left-hand side of the screen, click stages, and select orange stage. But thank you so much for joining us today and for this entire time. This was powerful. Thank you.